name is Beyonce Brown.
I'm Kabina Thompson.
And I'm Daniel Ingram.
Welcome to our arterial blood gas test presentation.
What is an arterial blood gas test? Well, an arterial blood gas test measures the carbon dioxide and oxygen levels in your blood and your blood pH. This is normally balanced and signifies good health. This test is taken from an artery and not a vein, and the healthcare providers routinely refers this for certain emergency situations.
Arterial blood gas test is important in health and illnesses as it assesses the functionality of the lungs and kidneys by measuring how well they work transporting the different gases in the body. It measures the acid-base balance in the blood and how well the body uses energy to release waste. It helps in checking if the treatments given to the patients for their lung problems are actually working. It helps in making the best decision in treating patients as it helps to check for severe breathing and lung problems such as asthma, chronic obstructive pulmonary disease, cystic fibrosis, and also sleep apnea. The arterial blood gas test is also significant in evaluating several conditions including severe sepsis, septic shock, diabetes-related ketoacidosis, and also renal tubular acidosis.
What is measured when taking an arterial blood gas test? Well, when doing an arterial blood gas test, you need to first take into consideration the 5 key components. Let's start with the pH of the blood. The pH of the blood ranges from 7.35 to 7.45. If it goes above the 7.45 value range, then the pH of the blood will become too basic or alkaline, and this is a condition known as alkalosis. But if it goes beyond the 7.35 value range, then this condition is known as acidosis, and this is when the pH of the blood is too acidic. For bicarbonates, the normal values ranges between 22 to 26 milliequivalents per liter. If the value goes above the normal value, then it will lead to a condition known as metabolic alkalosis, and this is when there is an excess of the bicarbonates in the blood. Common causes for this are low potassium levels in the blood, vomiting, and hyperventilation. But if the bicarbonate decreases in the blood, then this condition is known as metabolic acidosis. Common causes for these are seizures, kidney failures, and diarrhea. For partial pressure of carbon dioxide, the normal values ranges between 35 to 45 millimeters of mercury. If it rises above the 45 value range, then this is due to accumulation of carbon dioxide in the blood, and the common causes for these are asthma, chronic obstructive pulmonary diseases, and pneumonia. But if it falls below the 35 range, then this condition is known as, it could lead to the condition known as respiratory acidosis, and common causes for this could be fever, hyperventilation, and anemia. For partial pressure of oxygen, the normal values are ranges from 75 to 100 millimeters of mercury, and for oxygen saturation, 94 to 100%. What could cause your oxygen levels to fall is any respiratory illness such as asthma, pneumonia, and any viral infection. Partial pressure of oxygen measures the amount of oxygen in the blood, and it also measures the pressure of oxygen dissolved in the blood. It also helps to show how oxygen moves from the lungs to the bloodstream. Partial pressure of carbon dioxide measures the amount of carbon dioxide in the blood and how well it can move out of the body.
Oxygen saturation is a measure of how much hemoglobin in the blood is carrying oxygen. Oxygen saturation levels ranges from 94 to 100%. High oxygen saturation levels lead to hyperoxia, while low oxygen saturation levels lead to hyperoxemia. Total carbon dioxide. So total carbon dioxide is a measure of how much carbon dioxide is in the blood.
High levels of carbon dioxide leads to metabolic alkalosis. Low levels of carbon dioxide leads to metabolic acidosis.
When the body is functioning normally, the partial pressure of oxygen is about 75 to 100 millimeters of mercury at sea levels. Altitudes above 3,000 feet causes these values to get higher. The pressure of all gases is about 760 millimeters of 1,260 meters. The atmosphere holds 53% as much oxygen as air at sea levels, making it harder to breathe. This is because the body produces new red blood cells, making it easier to supply oxygen to muscles and vital organs. High altitudes on carbon monoxide saturation. So carbon monoxide is a clear, odorless gas which has a high diffusion rate. It has a molecular formula similar to oxygen and nitrous oxide.
Anemia is a medical condition where the number of erythrocytes, also known as red blood cells, or the hemoglobin concentration within the individual is lower than normal. The red blood cells deform when there is an abnormal amount of hemoglobin and results in them being sickle or crescent shaped. The most common cause for an individual to be anemic is not having enough iron. Iron is a major component of hemoglobin, so if there is not enough, the body cannot produce enough hemoglobin, which is a substance that enables the red blood cells to carry oxygen around the body. This causes fatigue. Other effects of anemia are weakness, dizziness, tiredness, and drowsiness. Anemia also causes pain, shortness of breath, and it also affects the immune system, as iron deficiency negatively affects the proliferation of immune cells, therefore affecting the capacity to have an adequate immune response. The blood content of oxygen and carbon dioxide is dependent on hemoglobin concentration.
Okay, so here are the equipments that we'll be using in the arterial blood gas test. Okay, so we have our wet cotton that is used to sterilize. We have our gloves. We have our hand sanitizer. We have our tape. We have our test tubes. We have our syringe with our needle. We have our gauze, the igloo, the sharps bin. This is also another example of a sharps bin. Yes. Come in. Good morning.
Good morning.
Please have a seat. Sanitize. So my name is Dr. Ingram and you are?
Beyonce Brown.
Okay, Miss Brown, just for confirmation, may I have your date of birth?
September the 15th, 2003.
Thank you. Your address?
Mount Pleasant, Illinois.
Okay, thank you. So I see here where you were referred to do an arterial blood gas test. However, I'll need to do an Allen's test first.
Okay.
Can you please use? Okay, so the Allen's test is used to assess the blood supply in the arteries of the wrist. Okay. So make a face. Thank you. May I?
Yes, ma'am.
Okay, so apply pressure to both sides of the wrist. Okay. Release. Okay. Okay, so now that we've completed the Allen's test, we'll continue with the arterial blood gas test. Okay, so just for confirmation again, Are you allergic to any medications?
No.
Have you ever been told that you have any circulatory problems?
No.
Any blood clotting problems?
No.
Are you on any blood thinners such as ibuprofen?
No.
Okay, so there are 3 points at which the arterial blood gas test can be assessed. That is your radial artery in your wrist, your brachial artery, and your femoral artery in your groin. Right? However, today you'll be taking it from the radial artery. Okay, all sanitized. Okay. First, apply pressure. Okay, thank you. Okay, so we'll inform you when the results are in. Thank you so much for coming, Ms. Brown.
Thank you.
Have a wonderful day.
Same to you, Dr. Ingram.
Procedures of arterial blood gas blood sample handling. First, you have to evaluate the ventilation of acid base, and this includes the pH, the partial pressure of carbon dioxide status, and oxygen status, which includes the partial pressure of oxygen and oxygen saturation, and the oxygen carrying the capacity of blood, for example, the partial pressure of oxygen. Secondly, you have to assess the patient's response to therapeutic intervention and or diagnostic evaluation, for example, exercise testing and oxygen therapy. You have to also monitor the progression and severity of the observed disease. Also, evaluations are usually done in patients that have multiple organ failure, both chronic and acute, for example, respiratory failure. And just to name a few, we have septic patients, critically ill patients, poison patients, patients with burns, and ventilated patients.
ABG measures the pH of the blood. ABG measures the pH of the blood. It measures the acidity and it measures the basicity. ABG measures the pH of the blood. It also measures the partial pressures of the blood. It measures the partial pressures of the blood. The partial pressures of O2 and the partial pressures of CO2. It measures the partial pressures of the blood. There are many significances of ABG, including evaluating sepsis, assesses the lungs and also the kidneys, and to see if lung treatments are working. ABG measures the pH of the blood. It measures the partial pressures of the blood. It is important in diagnosis, pH balance. Please know this arterial blood gas test.
Welcome to our arterial blood gas test presentation.
That's correct.